Hi, my name is Abria Bennett and I'm a student nurse at the University of South Alabama. Today I'll be initiating the intravenous saline lock. I'll first like to acknowledge that I have performed hand hygiene, and now I'll verify the hospital policy as well as the order. Now what I will do is I will identify my patient using two identifiers. First the name, Jaguar J. Jones. Jaguar J. Jones, date of birth is 8/25/1963. Date of birth, 8/25/1963. My patient has an allergy to penicillin. Allergy to penicillin. At this time, I will also ask my patient if he or she has any other allergies that I should know about. I will explain the procedure to my patient and I'll provide my patient privacy. I will also make sure I will gather all of my materials. Now what I will do is I'll position my trash can and perform hand hygiene. I will don my goggles. After donning my goggles, I will then come over to my patient and I will raise my patient's bed to a good working height, lowering the side rails, and I will assist my patient to a comfortable level in either supine or a sitting position. I will also make sure my patient has privacy. Now coming over to my bedside table, I will maintain a sterile technique when opening my packages as well as when I arrange them or organize them onto my table. Okay. I would first like to acknowledge that I do not have the correct size Tegaderm in my blue bag, so I am working with what I have today. I only had the correct size that was enclosed in my other steel packet. Okay, so the first thing that I'm going to do is I'm going to open my alcohol swab, and I'm then going to clean by swabbing the injection cap with a sterile technique. Okay, what I will do now is I will then prime my saline lock, making sure that I keep the syringe connected. Now I would then open my over the needle catheter, and I will then open my transparent dressing. After I have done this, the next thing that I will do is I will explain the three principles. The first principle is what we will do when we are selecting a vein. We will choose the most distal site. We will make sure that we can possibly choose a non-dominant arm, and we will choose a large, a spongy, a bouncy, or a soft vein. Now explaining the three principles for the fostering of the venous distension. We will distension. Excuse me. It will be. We will make sure that we can first. The first thing that we will do is we will make sure that we can place the extremity in a dependent position. We will make sure that we can apply any warmth to vasodilate for several minutes, and we will make sure that we stroke the vein lightly. The next thing that I will begin to do is I will begin to apply my tourniquet, and I will do this 4 to 6 inches above the injection site. After I have done this, I will assess my patient's radial pulse, and I will assess for any vein appropriateness. After I have done this, what I will do now is I will don my clean gloves, and I will be sure to move my saline lock closer nearby and on the bed the overbed table. The next thing that I'll do is I will begin to clean the injection site with my chlorhexidine prep. I will activate it and I will clean, first having friction vertically, horizontally, and in a circular motion. First going in a circular motion, now vertically, now going horizontally. I will dispose of my chlorhexidine swab. Now what I would do is I would begin to demonstrate the venipuncture. I will do this by anchoring. I will anchor in the vein 1.5 to 2 inches, and I will do this below the injection site. And I will also make sure that I will gently spread my patient's skin, and I will do this away from the direction of the insertion site. I will also ask my patient to remain still, as this will be a quick stick. I will insert it, first going at a 10 to a 30 degree angle. And I will make sure that the bevel is pointed upwards. It is pointed upwards. I will make sure that it is parallel to the vein. And I will also make sure that I would assess for any blood return before continuing. Now what I will do is I will lower it 1/4 of an inch, and now I will begin to move the hub closer to the catheter. As you can see that the needle or the stylus did not move. Okay, and now what I will do is I will undo my I will undo it, my turpicant. And the next thing I will do is I will push down 1 1/4 inches, now removing my stylus or my needle, and I will dispose of it in my sharps container. After doing this, I will then make sure that I remove my capping. After I have removed my capping, I will then quickly connect it. After I quickly connect it, what I will then do is I will get my first piece of tape and I will secure it. After securing this thing, my saline lock, what I'll do is I will make sure that I grab my transparent, I will grab my transparent dressing, and I will then place it over the hub only, not under the dressing. And as I have stated before, I did not have the correct size. Okay, as I have done this, the next thing that I will do is I will then begin to assess for any blood return, because I will aspirate first, and after aspirating, I will then I will then begin to administer the rest of my saline into my patient. And in a normal hospital setting, I will be able to do this correctly, but this is a pool noodle, so it would spill out, so I will not do it at this moment. The next thing I will do is I will then secure the IV after removing my saline. As I have done this, I'll make sure that I have observed for any swelling, and I will dispose of my flush saline as I have flushed it into my sharps container. After I have done this, the next thing that I will do is I will then begin to secure the IV as well, the IV tubing as well as the IV with my second piece of tape. And this will allow for the saline lock to resume to its natural position. I have my tape disposed. Now I will dispose of my gloves and any of my equipment. I will then begin to label, making sure that I stay away from the actual insertion site. Can you see? I have it on my on the edge of my patient's drainage. And I will label the gauge, the date, the time, and I will also have my initials. I will make sure I reposition my patient safely by lowering the bed, raising the side rails, and I will also instruct my patient how to prevent any dislodging and any signs and symptoms for complications relating to the IV. Any signs and symptoms could be the infiltration, inflammation, or phlebitis. Anything to prevent dislodging could be that the I will also like to tell my patient that if my patient experiences any slowing or any stopping in the IV, or if there is any blood in the tubing or the drainage, to notify the nurse. And the next thing we were going to do is we are going to next perform hand hygiene. After I perform hand hygiene, I will make sure that I will document the date, the time. I will also document the number of attempts. I will document the describing the location. I will document the presence of a saline lock. I will document the flow of the water. I will document the flow. I will also document my patient's tolerance. I will document the I will document if there was any order infusion, what fluids were used. And the last thing that I will document is I will make sure that I have documented my patient's tolerances as well. I have documented 9 things. Now what I will begin to do is I will discontinue the IV. I will put on my clean gloves. After putting on my clean gloves, the next thing that I will do is I will make sure I discontinue with the saline lock, performing an asepsis or any hemostasis. The first thing I will do is I will begin to pull towards, I will lift up and I will remove it towards the insertion site. Okay, and the next thing that I will do is I will then grab my gauze and I will place my gauze over my I will place the gauze over the catheter. After I have done this, I'll make sure that it is parallel to the skin, and I will remove my temporary piece of tape. After I have done this, I will then make sure that it is intact. Once I have removed it, and I will look at it, make sure it is intact before disposing it in my sharps container. The next thing that I'll do is I'll make sure that I bear down or hold it for 30 seconds to stop any blood. And if my patient has taken an anticoagulant, I will make sure that I do this 5 to 10 minutes. And I will also like to do is I will now secure the taping. After I have secured the taping, I will ensure my patient's safety, as well as I will ensure my patient's safety and level of comfort by lowering the bed, raising the side rails, and I will make sure that my patient has a call light at all times. I will dispose of my equipment as well as my gloves. I'll perform hand hygiene, and then I will document. Thank you, and this will conclude my skill.